Kia ora everyone, I am Jenna Joyce Ibonya, and today I'm going to discuss communication skills and how important they are in ensuring safe and effective reprocessing. First, let's define effective communication and why we need to talk about it in the context of reprocessing. Effective communication is the clear, accurate, respectful, and timely exchange of information. It is extremely important in a high risk and fast paced environment such as the CSSD that messages are understood clearly and correctly to prevent errors and misunderstandings that directly impact safety, quality, compliance, and teamwork. And the way to effectively communicate within the reprocessing environment is through communication skills, which I will discuss shortly. So in this presentation, I will discuss the communication skills that I have personally used in the workplace, and these are speaking up for safety, active listening, and assertive oral communication. For each skill, I will explain what the skill means, provide a workplace example, and discuss how each communication skill was effective in ensuring safe practice and positive teamwork. So going back, let's now look at the skills that make effective communication possible. Communication skills are the methods, abilities, and techniques that people use to share and receive information. This information may include thoughts, ideas, and emotions, and also instructions and concerns that the speaker wants the listener to understand accurately. So, communication skills involve more than just speaking. They also include nonverbal communication, such as facial expressions, body language, gestures, and posture, which can influence how a message is interpreted by the listener. In addition, communication skills also encompass active listening, written communication, and the ability to provide clear and appropriate responses. So, when these skills are used effectively, they help reduce misunderstandings and improve teamwork, support safe work practices within the healthcare environment. So, now that we have established an understanding of communication skills, I will begin by discussing the first skill, which is speaking up for safety. So, by the definition of Okuyama et al. In their study in 2014, speaking up means confidently raising concerns about unsafe practices, hazards, or situations that may compromise the safety of patients, staff, or the workplace. So it requires confidence, professionalism, and responsibility to be able to communicate concerns respectfully and promptly, that is, upon recognizing them, to prevent harm. So I believe speaking up is one of the most useful communication skills in CSSD because we work in a high-risk environment with contaminated instruments, chemicals, heat-producing equipment, and strict infection control procedures. So speaking up helps create a safe and comfortable workplace because people are able to report risks before incidents occur. One example of speaking up for safety involved the sink ventilation system not working properly in the decontamination area. So, because the ventilation system wasn't functioning, some staff members began removing the splash guards from the sinks because they easily fog up and obstruct vision when cleaning instruments. So, I recognized immediately that this created a safety risk because splash guards are there for a reason. They minimize exposure to contaminated water and reduce the spread of aerosols during cleaning. So, especially since we're using high pressure water, aerosols are easily generated, which can result in cross contamination to nearby instruments, equipment, and clean work areas, and risk staff inhalation of airborne microorganisms, chemicals, and blood particles. So I immediately spoke up to the supervisor and reported both the ventilation issue and the unsafe practice. During the next handover, it was mentioned that the splash guards must never be removed from the sinks and action was taken regarding the faulty ventilation system. So I realized that speaking up helps bring attention to possible hazards and incorrect practices that can endanger myself and my colleagues. By speaking up, I helped reduce the risk of exposure and prompted safer work practices within the department. The second communication skill is active listening. Active listening involves fully concentrating on understanding and responding thoughtfully to what another person is saying. So it is more than simply hearing information. It involves paying close attention, asking questions when needed, and confirming your understanding. So in CSSD, active listening is important because staff regularly receive technical instructions about new instruments, updated procedures, equipment operation, and infection control requirements. So, misunderstanding information can lead to errors in cleaning, packaging, sterilization, and storage processes, which can directly affect patient safety. Active listening also demonstrates professionalism and respect because it shows that the speaker's information is valued and understood. So, one workplace example of active listening was during an in service education delivered by a company representative about a new consignment instrument. So, during the session, I listened carefully to the representative's instructions regarding the correct cleaning process, handling precautions, and assembly requirements of the instrument. I focused on understanding the information completely and asked clarifying questions about the correct method of reprocessing. I also observed the demonstrations carefully to ensure I understood the manufacturer's instructions correctly. I remember I asked to confirm how many instruments were to be disassembled during cleaning and how many were cannulated. So, active listening communication skill was effective in this scenario because it helped prevent errors when cleaning and handling the new instrument. I paid attention to the speaker because she was sharing technical and safety critical instructions. As a result, I am able to recognize the new instrument and reprocess it according to manufacturer guidelines, reducing the risk of damage, contamination, or improper sterilization. This example demonstrates how active listening supports safe practice, accuracy, and compliance with sterilization standards. The third communication skill is assertive oral communication. Assertive oral communication is the ability to express concerns, instructions, or opinions clearly, confidently, and respectfully while considering the perspectives of others. Assertive communication is different from aggressive communication because it remains respectful and it's open to others' point of view and focused on safety rather than blame. Being assertive is important in healthcare because staff often need to communicate safety concerns quickly and professionally. In reprocessing environments, assertive communication helps ensure that procedures are followed correctly and that unsafe actions are addressed immediately. One personal experience of assertive oral communication occurred when I was in charge of sterilizing, and a nurse wanted to take an instrument tray immediately after it came out of the sterilizer. I communicated clearly and respectfully that the tray had not cooled down yet, so it must not be handled or used immediately. I could tell that the nurse was in a hurry, and she even told me that the patient is already on the operating table, but I still stood my ground. I apologized and told her there's nothing I can do but wait for the instrument to cool down since cooling time is necessary after sterilization. I was confident to tell her that handling hot trays too early may compromise its sterility due to condensation and can also create a burn risk. Although the nurse was in a hurry, I remained calm, respectful, and firm when I was explaining the safety requirement. This communication skill was effective because the nurse understood the reason for the delay and the tray was allowed to cool properly before use. By communicating assertively, I helped maintain sterility standards and prevented potential safety risks for both staff and patients. So to summarize, communication skills play a vital role in ensuring safe work practice within the reprocessing environment. So the three communication skills discussed in this presentation were speaking up for safety, which helps identify and prevent workplace hazards before harm occurs. Active listening, which ensures that important information and instructions are understood accurately, reducing the risk of errors during reprocessing. And assertive oral communication, which allows staff to communicate clearly and respectfully their safety concerns even during challenging situations. So together, These communication skills help minimize errors and misunderstandings, especially in a high risk environment like the CSSD, where errors can directly impact the safety of patients and staff, as well as infection prevention and the quality of instrument reprocessing. Besides promoting safe work practices and quality patient care, effective communication also promotes compliance with standards and positive teamwork within the reprocessing environment. And that's it for my presentation. Thank you for listening. If you want to know the references, especially for the definitions of the communication skills, these are what I used. Thank you for listening.